Disorders. There are several types of menstrual disorders. Problems can range from heavy, painful periods to no periods at all. There are many variations in menstrual patterns, but in general women should be concerned when periods come fewer than 21 days or more than 3 months apart, or if they last more than 10 days. Such events may indicate ovulation problems or other medical conditions. Abnormal uterine bleeding, AUB, which may include heavy menstrual bleeding, no menstrual bleeding, amenorrhea, or bleeding between periods, irregular menstrual bleeding. 2. Dysmenorrhea, painful menstrual periods. 3. Premenstrual syndrome, PMS. 4. Premenstrual dysphonic disorder, PMDD. Abnormal uterine bleeding. Abnormal uterine bleeding, AUB, is any deviation in normal frequency, duration or amount of menstruation in women of reproductive age. Normal menses. Frequency: 21 to 35 days. Duration: 3 to 7 days. Volume: 30 to 80 ml. Abnormal uterine bleeding can occur as spotting or bleeding between your periods, for longer days than normal, heavier than normal. Types of uterine bleeding disorders: amenorrhea, absence of menstruation. Polymenorrhea, frequent menstruation at regular intervals, less than 21 days. Menorrhagia, excessive and/or prolonged menstruation at regular intervals, greater than 80 ml. Metrorrhagia, excessive and/or prolonged menstruation at irregular intervals, greater than 80 ml. Menometrorrhagia, both. Intermenstrual bleeding, episodes of uterine bleeding between regular menstruation. Hypomenorrhea, scanty menstruation. Oligomenorrhea, infrequent menstruation, greater than 35 days. Causes: every woman's menstrual cycle is different. On average, a woman's period, menstrual flow, occurs every 28 days, although cycles may vary between 21 and 35 days. Menstruation flow normally lasts about 3 to 7 days. Young girls may get their periods anywhere from 21 to 45 days or more apart. For most women, female hormone levels change every month. The hormones estrogen and progesterone are released as part of the process of ovulation. When a woman ovulates, an egg is released. AUB can occur when the ovaries do not release an egg. Changes in hormone levels cause your period to be later or earlier. Your period may sometimes be heavier than normal. AUB is more common in teenagers or in premenopausal women. Women who are overweight also may be more likely to have abnormal uterine bleeding. In many women, abnormal uterine bleeding is caused by a hormone imbalance. It can also occur due to following causes: thickening of the uterine wall or lining, uterine fibroids, uterine polyps, cancers of ovaries, uterus, cervix, or vagina. Bleeding disorders or problems with blood clotting. Polycystic ovary syndrome. Severe weight loss. Hormonal birth control, such as birth control pills or intrauterine devices, IUD. Excessive weight gain or loss, more than 4.5 kilograms. Infection of the uterus or cervix. Symptoms. Abnormal uterine bleeding is unpredictable. The bleeding may be very heavy or light, and can occur often or randomly. Symptoms of abnormal uterine bleeding may include bleeding or spotting from the vagina between periods. Periods that occur less than 28 days apart, more common, or more than 35 days apart. Time between periods changes each month. Heavier bleeding, such as passing large clots, needing to change protection during the night, soaking through a sanitary pad or tampon every hour for 2 to 3 hours in a row. Bleeding that lasts for more days than normal or for more than 7 days. Other symptoms caused by changes in hormone levels may include excessive growth of body hair in a male pattern, hirsutism, hot flashes, mood swings, tenderness and dryness of the vagina. A woman may feel tired or fatigued if she loses too much blood over time. This is a symptom of anemia.